I'm Gina. I'm a social scientist, and for the last 3 years, I've been studying the culture of data. And I think what we've found has some really powerful design implications that I want to share with you tonight. It starts in Sitka, Alaska, where a patient of one of my collaborators is from. When they were talking about the values and goals of cancer treatment, he said, "What do you want?" And the patient said, "I want to die looking out my living room window." Patient data comes in a lot of different forms. There's pictures that are drawn, stories that are charted, histories that are mapped. We need to remember that this data comes from a lot of different places and a lot of different people. Katie McCurdy, some of you may have heard of, is an interaction designer who drew a visualization of her memories of 35 years of experience with her chronic disease. She did this because she wanted to be heard. And yet, there's enormous possibilities right now from a whole host of kind of pervasive mobile sensing devices. But before we talk about this kind of data, we need to be really clear on what data can and cannot do. Data can mean different things to different people, and what looks like science in one setting may actually be art in another. And this can tell powerful stories about people, powerful stories that can have meaning in their care. Because data really depend on where you are, where you sit. This kind of institutional approach to data can help us design better solutions. What's useful for patients may be data that helps them connect or tell their story. Doctors, of course, need data that's clinically actionable. And without clinical actionability, the data risks and liabilities simply aren't worth it. That's partly to explain for the difficulty that we have in understanding our data at this moment. That's not to say there's not a room for messy data or patient-generated data in clinical decision-making, but we need to contextualize that data and recognize that maybe it's better for communicating values or as a starting point for conversations. N of 1 data is super exciting, but it's not acting in the same way as population data is. Once we let go of the idea that data is equal in all contexts for all environments, then we start to recognize that data is not a straight out-of-the-box, ready-to-use generic solution. Data needs some work. I wish it were as easy as doing my laundry. Data require work, and especially in the healthcare context, data require labor and time. And that's a lot of the resistance that doctors are expressing around accepting patient-generated data. My first statistics professor taught me that you should always let the data speak for themselves. But she was wrong. Data always require someone to speak for them. And data require a voice. So I'm proposing Dr. Data Kitty. A warm, fuzzy data solution that's ready to provide diagnosis based on any kind of data that you have. Because everybody needs a kitten in their slides, right? Or better, let's start to talk about information and data coming from multiple streams, where a doctor is a source of information, not the source of information. In this changed information, social media-rich landscape, patients need help kind of figuring out and thinking through the data that they're looking at. Could we imagine a future where patients curate and share such data with their doctors? Where they could co-interpret that data. These visualizations are based on work that a graduate student of mine has been working on. Can we imagine an environment where patients and doctors together look at all kinds of messy sorts of data that might not be clinically actionable, but could still provide really rich ways for coming together around decision-making, around values, around communication, conversation, and connection? This data could include self-tracking data, where patients are reflecting and thinking about this data. They could have spaces to curate and actually be the algorithm. I think rethinking the cultures around data is a huge starting point for imagining better health innovation solutions that actually serve more people. Let's remember that data can really lead to empathy. Thank you.